Dashboards are powerful tools for visualizing data and gaining insights into various aspects of business performance. They provide interactive and intuitive interfaces for users to explore and analyze data. Here are the key components and features of SAC dashboards: interactive charts and graphs, smart insights, storytelling, predictive analysis, financial performance management, human resources analysis, sales and marketing analysis. Welcome to your Frontline Command Center for Public Health Monitoring. This overview page brings together the most critical health indicators, helping leaders understand the overall burden, identify risks, and act with precision. We begin at the very top with the key KPIs. Total disease cases reported stand at 117,000, capturing the overall health burden across the population. Alongside this, 39,000 mental health cases are reported, highlighting the growing importance of psychological well-being. Chronic conditions remain significant, with 78,000 chronic disease cases, while the average patient wait time is 65 minutes, shows the pressure on healthcare facilities. Next, we move into the regional picture. The North Zone reports the highest number of cases at 41,009, followed by the Central Zone with 25,932, the East Zone with 25,303, and the South Zone with 24,802. This helps pinpoint where the greatest concentration of disease burden lies. Next, we look at efficiency by facility type. Public hospitals record an average wait time of 65.99 minutes, slightly higher than 64.54 minutes in private facilities. This reflects the higher patient load in public care settings. Next, chronic disease cases are analyzed by socioeconomic status. Here, 40.13% of cases come from the low-income group, compared to 30.05% in the middle-income group and 29.82% in the high-income group. This distribution signals health inequities that extend beyond medicine into social and economic dimensions. Next, we examine regional wait times. The North Zone shows the longest wait at 69.09 minutes, followed by the East Zone at 67.46, the Central Zone at 63.32, and the South Zone at 59.49. These delays reveal regional bottlenecks in service delivery. Next, we break down total disease cases by gender. Males report 40,218 cases, females 37,136, and the other category 39,692. This gender split helps guide targeted communication and outreach programs. Finally, we end with the fiscal year view, which is the story filter, offering a time-based lens to track whether the burden is rising and where preventive measures must be strengthened. To add more flexibility, this dashboard also provides filters for age group and region, enabling decision-makers to slice the data by specific demographics or geographical zones. This makes it easy to uncover hidden patterns and tailor interventions with precision. We now move to the Population Health and Wellness Insights view, which takes us deeper into the underlying health challenges shaping our communities. We begin with the key metrics at the very top. The average infant mortality rate stands at 13%, serving as a crucial indicator of maternal and child health. Alongside this, we see the average smoking prevalence rate at 24%, highlighting one of the major lifestyle-driven risks that fuel chronic disease. Finally, obesity emerges as another critical concern, with an obesity rate of 30% for individuals with a BMI greater than 30. These three figures anchor our wellness outlook and highlight areas requiring long-term intervention. Next, we examine how infant mortality varies by region. The North Zone records the highest rate at 15.38%, followed by the South Zone at 13.45%, the East Zone at 13.31%, the Central Zone at 13.03%, and the West Zone at the lowest at 11.75%. This spread shows us where maternal and child health programs may need the most attention. Next, we look at smoking prevalence across age groups. The rate climbs steadily with age, starting at 22.66% among those under 14, rising to 25.76% for the 15 to 24 group, 20.77% in the 25 to 44 group, 26.57% for ages 45 to 64, and 24.91% among those above 65. This pattern reinforces the need for targeted anti-smoking campaigns at both younger and older age brackets. Next, obesity prevalence is broken down by gender. Males show the highest share at 34.76%, followed by females at 33.39%, and the other category at 31.85%. These insights can guide gender-specific health awareness campaigns. Next, infant mortality is analyzed by gender. The other category records the highest rate at 15.41%, compared to 12.83% among males and 12.15% among females. Such disparities call for closer examination of access, care, and inclusivity in healthcare systems. Next, we move to mental health cases reported by facility type. Public facilities report 28,830 cases, significantly higher than the 23,089 cases in private facilities, pointing again to the reliance of communities on public healthcare infrastructure. Next, socioeconomic factors are overlaid against infant mortality and smoking prevalence. Infant mortality stands at 12.44% for the high-income group, 13% for low-income, and 14.97% for middle-income communities, while smoking prevalence runs parallel at 24.43% for high-income, 23.41% for low-income, and 24.15% for middle-income. This dual lens highlights how social and economic context influences health risks and outcomes. Next, we explore mental health cases reported by fiscal year. For the year 2024 to 25, a total of 51,919 cases have been recorded, demonstrating the growing importance of integrating psychological health into mainstream public health planning. Next, smoking prevalence is reviewed by region. The Central Zone tops the chart at 28.55%, followed by the East Zone at 25.01%, the North Zone at 24.18%, the West Zone at 22.41%, and the South Zone at the lowest, with 21.03%. This helps us identify where lifestyle intervention campaigns must be prioritized. Finally, we look at smoking prevalence across genders. Males again record the highest rate at 33.99%, followed closely by females at 33.22%, and the other category at 32.79%. This almost uniform trend suggests that smoking habits are deeply ingrained across demographics, requiring universal but also targeted anti-smoking initiatives. To enhance the flexibility of insights, this page also allows filters by age group, facility type, and gender, enabling a more customized view into how health risks and outcomes differ across population segments. This makes it easier to design policies that are not one-size-fits-all, but tailored to the realities on the ground. Moving to the third page, which is your frontline command center for monitoring public health risks and the strain on critical resources. This page blends vaccination coverage with emergency room demand, giving leaders a dual view of prevention and response. We begin at the very top with the two headline KPIs, where the vaccination coverage rate stands at 77%, reflecting the immunity shield across the population. Any drop below 80% in a region should trigger rapid response, from mobile vaccination drives to supply chain audits. Next, the emergency room utilization rate is at 70%, a warning sign that many citizens are relying on ERs, potentially for non-critical issues. Persistent overcrowding signals weak primary care access and requires system redesign. Next, we move into regional vaccination coverage. The South Zone leads at 83.33%, comfortably above the threshold, while the Central Zone lags at 73.79%. These differences help policymakers target underperforming regions with tailored awareness campaigns. Next, vaccination is broken down by vaccine type. COVID-19 coverage tops the list at 80.68%, followed by flu at 78.97%, HPV at 74.05%, and polio at 73.46%. Lower rates in specific vaccines can point to gaps in supply or public trust, highlighting where targeted education is most needed. Next, we compare by facility type. Private centers record 78.36% coverage, slightly ahead of public facilities at 75.99%. This performance gap can inform investments in strengthening public clinics or exploring public-private partnerships. Next, we shift to emergency room usage by age group. Children aged 0 to 14 have the highest ER usage at 74.33%, while young adults 15 to 24 use ERs the least at 64.91%. Seniors, 65 plus, sit at 69.07%, showing that both ends of the age spectrum lean heavily on emergency services, a sign that specialized community care could reduce this pressure. Finally, we analyze ER utilization by gender. Females show the highest reliance at 75.53%, compared to 68.43% for males and 64.88% for others. These differences may reflect access barriers, care-seeking behaviors, or unmet needs, and should guide gender-sensitive outreach strategies. This page closes with powerful filters: age group, facility type, and gender, giving decision-makers the flexibility to drill deeper and uncover hidden drivers of risk. Together, these insights connect prevention through vaccination with the reality of emergency demand, ensuring health systems can anticipate, adapt, and act. Welcome to the Healthcare Services and Facility Performance Dashboard, your single view into how hospitals and clinics are performing across regions, age groups, and patient demographics. At the very top, the hospital bed occupancy rate stands at 76%, showing that most hospital capacity is already in use. This tells us how stretched our resources are and whether we have enough room for critical emergencies. Alongside this, the average length of stay is 8 days. This metric captures how long patients typically remain admitted before being discharged, helping us understand turnover efficiency in hospitals. The readmission rate within 30 days is 13%. This figure is a strong indicator of care quality, showing us how many patients need to return soon after discharge, whether due to complications or incomplete recovery. Finally, the fourth KPI, outpatient visits per 1,000 people, stands at 27. This reflects the demand for outpatient services and highlights how frequently people are relying on hospitals without being admitted. Now, moving into the visual breakdowns, the hospital bed occupancy rate by region shows clear variations. The South Zone is the busiest, with occupancy exceeding 80%, followed closely by the West Zone. The Central Zone, by contrast, has the lowest usage at just above 71%, pointing to regional differences in patient load. The average length of stay by gender reveals a nearly balanced picture, with males, females, and other genders all averaging around 1/3 of total stays. This indicates that gender is not a significant differentiator in how long patients remain admitted. Looking at the outpatient visits per 1,000 people by vaccine type, we see that COVID-19-related visits are the highest at 8,000, followed by flu and HPV with 7,000 each, and polio at 6,000. This breakdown highlights which diseases are driving the largest outpatient demand. The readmission rate by vaccine type gives another view of patient outcomes. HPV-related cases have the highest 30-day readmission at just over 13%, while COVID-19 cases show the lowest, around 11.9%. The hospital bed occupancy rate by age group shows that adults in the 25 to 44 age range occupy the highest share of beds, closely followed by those aged 45 to 64. On the other end, the elderly population above 65 records the lowest occupancy, just under 70%. The readmission rate by gender and occupation type is presented as a bubble chart, showing clusters of male, female, and other groups. This allows us to see how different demographics are impacted by recurring hospitalizations. Regional differences come through again in the readmission rate by region. The South Zone shows the highest return rate, while the North Zone is the lowest, suggesting variations in quality of care and follow-up practices across areas. The average length of stay by region provides another perspective. Here, Patients in the North Zone remain admitted the longest, while the East Zone shows the shortest stays, revealing different patterns of recovery or discharge practices across geographies. Finally, a fiscal view is captured in the outpatient visits per 1,000 people for the year 2024 to 25, which reached more than 27,000. This year-over-year lens emphasizes the overall pressure placed on healthcare services and the growing demand across the system. Together, these KPIs and charts tell a connected story. How hospitals are being utilized, which demographics and regions face the greatest pressure, and where readmissions and outpatient demand are highest. With filters for age, region, and gender, leaders can drill into this data to uncover patterns and design more targeted health interventions. Page, summary table, which acts as our control tower, giving us a single view of lifestyle risks, hospital capacity, vaccination reach, and emergency reliance across different groups. Smoking prevalence is particularly higher among young adults in private facilities, touching almost 40%, while it remains much lower in children, pointing to where anti-smoking campaigns must be focused. Obesity tells a similar story, with middle-aged groups showing higher rates compared to younger populations, underlining the need for lifestyle interventions. Hospital bed occupancy reveals where the pressure is greatest. Some facilities are operating at more than 80% capacity, while others remain closer to 60%, highlighting regional differences in infrastructure strain. Vaccination coverage shows both strengths and weaknesses. In some groups, it is as high as 95%, but in others it drops to just over 50%, signaling urgent gaps in immunization outreach. Emergency room utilization adds another layer, with certain demographics relying on ER services nearly 90% of the time, while others use them far less. This contrast reflects both accessibility differences and how patients choose to engage with healthcare. Finally, all these measures are brought together in the total health risk rate, which distills smoking, obesity, hospital pressure, vaccination, and ER reliance into a single score. This makes it easy to identify which groups carry the highest overall health risks. And because actuals are shown side by side with planning targets, this table doesn't just tell us where we are today. It shows the gaps against our goals. Leaders can even simulate changes, such as how improved vaccination coverage might lower total health risk. In that way, this summary table transforms from a static report into a powerful planning tool for public health strategy.
It's not over yet. SAC also allows the export of data from individual charts or entire dashboards from SAP Analytics Cloud, ensuring that your data insights are easily shareable and accessible to your intended audience. It is a useful feature for sharing insights and reports with stakeholders who may not have direct access to SAC. We can export into Excel, then show and extract table data into Excel, and finally, export the dashboard as a PDF. Models in SAC define how data is organized, stored, and processed, enabling users to build accurate and insightful reports and dashboards. They support a wide range of features, from data integration and preparation to advanced analytics and collaboration, enabling users to create comprehensive and insightful analytic solutions. They are flexible as we can add additional fields as per the customer's requirement.
For information on these dashboards, KPIs, or required features, please contact VASPP Technologies.